Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and this video is for you if you've been dealing with some type of butt, let's call it Piriformis Syndrome, and or leg sciatica type problem for greater than 6 months or so. So I want to take some time today to share with you the top 5 reasons why your pain is not going away, why you're stuck in pain no matter what you try, it's just not getting better. And keep in mind, this advice comes from just years of experience working with people worldwide with unresolved back, butt, and sciatica problems. It's literally all I do. It's my exclusive specialty. And so just a disclaimer, I don't know everything, but I do have a lot of data. And when it comes to science, generally the person with the most data wins. So I want to share with you some advice today. Before I do that, if you're wondering, hey, what could be causing my butt and or leg pain, be sure to check out my Better Than an MRI DIY diagnostic guide, where literally I walk you through step by step exactly how you can figure out the most likely source of your problem. And I do this all for free, again, inside that DIY guide. Download it above and or check in the comments below. So the truth is, most piriformis syndrome and sciatica problems, they resolve naturally with time and with appropriate treatment within a 6-month timeline. Unfortunately, chronic piriformis and sciatica problems lasting more than 6 months, we'll call it, are very common. In fact, every day I chat with folks who have been suffering for, not only more than 6 months, but sometimes 6 years or 16 years or 26 years. So, that's a really long time to be in pain. And ultimately, this begs the question of, is there a really long-term solution to this problem? Can you cure piriformis syndrome and or sciatica? And why won't it just go away? So to help answer this, here are just some quick things before we get into the top 5 reasons why these problems won't go away. Here's something you should just understand about the way the body heals, so you can kind of get an idea of what is normal and what to expect if you have one of these problems. And I think it helps to sort of have a baseline understanding and recognition of just how adaptable and resilient the body is. So, if you've had sciatica, you probably had the feeling of wanting to cut your leg off, but don't do that because the body cannot regenerate like a lizard. It can't regrow a limb, but it can repair itself, and it usually does so in a very reasonable time. So I'm going to pull up a chart here that walks you through sort of expected healing time frames for different tissues within the body. So you can see that muscles, tendons, bones, ligaments, cartilage, even nerves are all designed to heal themselves within a reasonable time frame, usually within 3 months or so, but let's just give it a little bit buffer. Let's just say that you really injure yourself, right? There's something really gnarly that's going on, and so we'll just say, hey, within a 6-month time frame, it's totally reasonable and to be expected that whatever you have going on, whatever you've injured or damaged, right, is healed up. And if most things heal within 3 to 6 months, then it would make sense that your pain should go away within 3 to 6 months, but it doesn't always happen that way. So why are you still in pain? So in my experience, here are the 5 reasons why pain persists and just, again, won't leave. So I'm going to list these out and then we'll dive deep into each of them. So first things first, poor healing environment. The second thing, inadequate exposure. The third thing, anti-inflammatories and or steroid injections. The fourth thing, conditioned responses. This one's really interesting. And then the fifth thing is your current worldview. And be sure to stick around to the very end because this final one, your current worldview, is actually the most common thing that sort of keeps people from healing and sort of allows people to get in their own way. So let's talk about the first reason why pain persists and just won't quit, and is the poor healing environment, right? So if it's been 6 or more months and you're still in pain, an obvious theory as to why you could still hurt is that you just continue to pick the scab, right? Meaning chances are that, you could be doing things, think habits or routines, right, that continue to aggravate the problem and keep you from getting better. Now, here's the tricky thing. These habits, routines are usually things you don't know because you're so used to doing them. And so you can either try to figure this stuff out on your own or get some help doing the deep detective work that's necessary to sort of discover, again, that which is keeping you from getting better. And in my opinion, people jump far too quickly into doing different exercises and stretches for their problem, and they tend to overlook and kind of belittle the value in doing the detective work, again, needed to discover what in their physical environment is keeping them from getting better. So you can do all the exercises you want, but sometimes just making small tweaks to the way that you do things, right, can yield much faster and longer lasting changes. So for example, Emmanuel, a member of my Glute Relief Accelerator program, made a small little tweak to his sleep routine after doing some detective work and figuring out that that was in fact part of the problem. And he got 80% relief in just a week or so of joining the program. So again, small tweaks can lead to massive changes. Less is more. The second reason people stay stuck in pain is due to something I call inadequate exposure. So look, there's no question that the body was designed to move. And when you're in pain, you tend to, shut down, become fearful, move less, and just start to box your life in. You do less and less over time, right? You just avoid things in life. But here's the truth, right? The body requires challenge, stress, and strain to adapt, to change. And so I want to share with you something called Wolff's Law. Now, Wolff's Law pertains to bone healing and states that bones will respond or adapt in direct proportion to the amount of stress placed upon them. Meaning bones grow and adapt given stress and strain. They need it. They crave it. Failing to load your bones, right, and stress them out over time causes them to actually weaken. So applying this to healing, for example, of bones in this case, right, one of the best ways to strengthen bones for people who have brittle bones, think osteoporosis, osteopenia, things like that, is to actually have them lift weights and perform activities that adequately expose them to bone stresses, to stress them out. Tendons and muscles are the same way, right? So if you want big buns, not buns, if you want big guns or big buns, whichever you prefer, right, you've got to work and stress them out. Nerves, they function a little bit differently, but the same concepts apply, right? So if a nerve is sensitive, at some point you need to kind of get it moving again, and you need to desensitize it to specific movements and stresses. And obviously there's an art behind doing all of this, so I don't recommend that you start randomly picking up heavy objects if you have brittle bones, or doing some unsupervised exercise program if you're not exactly sure what you're doing, right? But consider that if you're not stressing out certain tissues within the body, right, then you perhaps are not creating enough challenge or enough stimulus to actually create a meaningful change or to promote healing. And people like myself, right, teach people how to use movement as medicine in a way that not only stimulates healing and repair of the body in a healthy way, but also tries to reduce the chances of you hurting yourself, right? So there's, again, a balance there. And because life equals motion, right, it makes sense and it's super important to prepare the body for getting back to full speed using, again, movement as medicine. The third thing that keeps people from healing is this continued use of anti-inflammatories and repeated steroid injections. So let me explain. If you've been taking anti-inflammatories for more than just a couple weeks after you've injured yourself, or have had multiple steroid injections, then chances are that you are actually keeping your body from healing. So as much as people don't like the pain or discomfort associated with that inflammatory response, right, just recognize that it is a necessary part of the healing process. If you don't have it, then you can't kickstart the cascade of other events needed for repair of your injured body. And so if you're constantly stopping the inflammatory process, right, by taking anti-inflammatories, right, when you hurt, things like Advil, meloxicam, naproxen, there's others as well, then you can actually impede the natural healing process. Not to mention all the other side effects associated with these non-steroidal anti-inflammatory drugs, sometimes referred to as NSAIDs, on your belly as well as on things like your heart. So now let's talk steroid injections. So steroid injections in the back, butt, and hip may offer temporary relief, but they limit the number of shots that you can get in this area for a reason, usually 2-3 a year. And it's well documented that repeated use of steroid injections can actually weaken and or damage body tissues. For example, people who have tennis elbow, a tendon problem on the outside of the elbow, if you've ever had it here, right? It's very painful, it's very uncomfortable, it's kind of naggy and takes some time to go away. So a lot of times people become impatient. They get steroid injections and they feel better short term, but the evidence is very, clear, and we show that people, yes, get quicker relief when they get a steroid injection to their elbow, but actually when you look at like a year afterwards, when you look at the long-term outcomes, people actually do worse if they've had a steroid shot. For folks with back pain and sciatica, steroid injections, again, might be helpful temporarily, right? But evidence suggests that they may actually increase the risk of infection after having certain types of back surgery. Not to mention they spike blood sugar. They cause, many of my patients to experience difficulty sleeping or insomnia, which is kind of important. There's a clear link between the amount that you sleep or the quality of your sleep and how much you hurt. So if you're trying to improve, does it make a whole lot of sense to get something, steroid injection, for short-term gain when it could directly impact your ability to sleep, which is directly related to how you feel? Not so sure that's what you want. So look, I'm not saying that these things, anti-inflammatories and or steroid injections, are never an option, right? When there is clear evidence of, an inflammatory, very painful response, right, and it's just too much to bear, then maybe, right? But prolonged use of these anti-inflammatory drugs and or repeated use of these steroid shots, especially around tendons, can actually limit your healing and or make you feel worse long term. And I'm guessing if you're still watching, it's the exact opposite of what you're trying to do, right? You're not trying to slow your healing, you're trying to accelerate it or speed it up. All right, so number 4, the fourth reason why you are stuck in pain and why everything you're trying is not working is due to something I call conditioned responses. And this is super fascinating, so make sure you listen up. Look, if you feed a hamster every time it runs on the wheel, right, then it starts to associate running with food, and it eventually gets pretty good at running. It runs faster and faster and faster, thinking the more I run, the more food I'll get. And just like animals, humans can become conditioned as well. So we can develop learned associations that can become strengthened over time with practice and repetition. So for example, if you give a kid a candy bar every time they throw a temper tantrum, right, then soon enough, they're just whining all the time because they know that every time they cry, right, they get candy. And so there's a stimulus and there's this response, stimulus response, and it just becomes strengthened. Now, if every time you sit, you experience pain, you begin to associate pain with sitting, right? Pain, sitting, or sitting, pain. Sitting equals pain, sitting equals pain. And so you develop this strengthened and conditioned response. And essentially, over time, you learn, right, to experience pain with sitting. So even if your body has fully healed, it's possible you continue to experience pain with certain movements or activities or positions because you've trained your brain to do so or to experience it and conditioned yourself to have that response. So even if your body has fully healed, it is possible that you continue to experience pain with certain positions or movements, right, or activities just because you've trained your brain, right, and conditioned yourself to experience that pain. So for example, Churchill had pain with sitting, and he pinned, just like everybody else, the cause of his pain on some physical thing, right? In this case, his poor sitting posture. Now, he had tried everything and it hadn't worked, but what we helped him discover over time, right, by breaking some of his old beliefs, which we'll get to in a moment, right, is that it had nothing to do with his posture. It had nothing to do with how he was sitting. Instead, it had everything to do with how he had conditioned himself to feel and what he had conditioned himself to experience while he was sitting. You could say he was well-trained. And so in cases like this, continued avoidance of movements and activities and positions actually further reinforces that which you're avoiding is dangerous, and it strengthens the conditioned response. This ultimately keeps you stuck in pain. And so the solution is to gradually expose yourself to that which you have experienced as threatening in the past, right? And retrain your pain, not your pain, your brain to experience the pain that you're feeling or the sensations that you're feeling through a lens of safety versus threat. As a final example, if this still is something that you have to wrap your mind around, watch it again and or just understand this, right? Like if you're afraid of heights, you cannot overcome your fear of heights, from the comfort of your bedroom wrapped in a blanket saying, I'm not afraid, I'm not afraid. Instead, you must show up to the cliff, right? You must look over the edge and you must sort of retrain your reaction or your response to those heights. So essentially, the only way for some people who have this type of conditioned or learned response, right, to overcome their pain is to have them move towards it, not run or flee from it. Exposure, not avoidance. And the fifth and final reason that is just so common with people I chat with all around the world who have these problems, and are just like, why can't I get better, is what I define as your current worldview. So please don't take this the wrong way, but it is quite possible that you are the one keeping yourself from improving. Right? Not intentionally, but given the beliefs you have about your current situation. For example, I got this message the other day from a person, right? And as you can see, it's just riddled with beliefs about their condition, what they think, what they know, what they feel, and just living in absolutes of what will or what will not work for whatever reason that they ascribe. And people are emotional creatures, especially when they hurt. When you're in pain, you tend to go insane, right? And so they tend to follow what they think or what they believe or what they know or what they feel, right? They should do versus, looking at the science and the facts and the evidence as it pertains to what they're dealing with. So here's another example of a message I got that also illustrates this point of just beliefs keeping you from getting better. So quick background, this person has been in pain since 2011. So, 12 years, which is a really long time at the time of shooting this video, and they had tried pretty much every type of treatment they could in person, right? Because they believed, and still believe, as you'll see in a moment, feel as though they need local hands-on treatment in order to improve their condition. But despite none of that working for the past 12 years, right, they still hold tightly to the belief that they need to see someone in person because that's the only way that they can get better. That's what they feel is best. And they don't understand how virtual treatment and education could actually change their situation. So hopefully you can see, right, that people have all kinds of thoughts and feelings that define their worldview, how they see things, right? And, this directly influences their actions or what they do, and ultimately their results. But the truth is, at some point you need to be able to separate the signal from the noise, right? That is, unless you receive some gain from continuing to be in pain, when do you lay off your beliefs? When do you drop them, right? Put them to rest and just admit like, hey, this is not working. And what if everything that you've been led to believe about, your condition is somehow untrue or not accurate? Is that possible? And if you're stuck in pain, could it be the beliefs that you have of what you think, you feel, etc., right, could actually be holding you back? And could it be possible that you need to work towards reinventing yourself as someone who is capable of healing? All right, so that's that. So in summary, again, here are the 5 reasons why your pain in the butt or your leg, your Piriformis Syndrome, and or maybe your sciatica problem is just not going away. So number 1, again, poor healing environment. Your life and the things that you're doing, routines, habits, etc., right, and or how you do them could just be continuing to pick the scab. And that environment that you've created for yourself is just maybe not conducive to actually getting better. Number 2, inadequate exposure. It is possible you're just not exposing your system or your body to either enough of or the right kind of movements or inputs, right, to actually create a real change. Number 3, prolonged use of anti-inflammatories and or repeated steroid injections, can actually delay the healing process. And the 4th thing, conditioned responses. Again, really fascinating. Just recognize that if you've been in pain for more than 6 months, it is absolutely possible your body might be fully healed, right? But your brain has been so well trained to experience pain with certain movements, activities, and or positions that you need to retrain it. And number 5, your current worldview. So recognize that your thoughts and your beliefs inform your actions and ultimately your outcomes in life. And it's no different for you if you're in pain and you're watching this. So if you're feeling stuck, just recognize that chances are, right, something that you must consider is that what you think about your pain could be completely wrong. What you know about your condition could be completely wrong or somehow inaccurate. And if this is the case, then the first step to healing is by breaking old belief patterns, right? How do you break old beliefs? Well, first you need to identify faulty belief patterns, right? Then you need to separate the fact from the fiction and use actual evidence, right, and science to start to look at things more objectively. So that's all I've got for this video. Again, we talked about the 5 reasons why your pain just won't go away and why you're stuck dealing with some type of problem in your butt and or your leg. So hopefully this was helpful. Let me know in the comments below. Maybe one of these reasons really resonates with you. You might want to do a deep dive into one of them. If you want to know more, just comment below. I'll be happy to help you out. And or be sure to hit subscribe as well as the bell for notifications when I post new content every single week. That's all I got. Until next time, thanks everyone, and we will hopefully chat soon.